How can young people be supported to exit homelessness permanently?
Okay. So I think that when we talk about LGBTQ2S youth, I think it's very important to keep in mind that LGBTQ2S youth experience homelessness at younger ages, right, compared to heterosexual and cisgender youth. And we know that when youth experience homelessness at younger ages, then they experience longer episodes of homelessness and just run into more issues in the long run, and then it becomes a lot more difficult to actually exit homelessness permanently. So keeping that in mind, I think that it's very important to place more emphasis and focus on early intervention. So, for example, working with young people in the school system. Okay, so working with young people in the school system before a young person actually maybe comes out to their family, or when they're in that process, and trying to really build those supports and provide those supports to the young person and to their family, obviously if they're open to receiving it. So I would say that really, early intervention, prevention, of course, as we're talking about, and then and also focusing on those factors that we call protective factors. So factors that will protect young people from suicidality or from mental health issues. And some of those protective factors for LGBTQ2S youth are really peer groups. We know that peer groups, peer support, that is absolutely key, and building supportive relationships with family and friends. So trying to find those supportive people in their lives, helping them find those supportive people, and also redefining our definition of family and what it means, and who's considered family, and because we do have sort of like family reconnection programs already in place. But I think that it's important to keep in mind that for LGBTQ2S youth, they're not always going to be able to reconnect with certain members of their family. And queer and trans people, like we're very good at creating our own families, our own chosen families. And so I think it's important to respect that, and to really build on those relationships, and to support youth when they do have those strong relationships. And then something else that I will mention is that programs like case management obviously is very important, and having that like ongoing sort of support, whether that be the peer support or the case management type of support. I think that's very important to implement into programs actually for LGBTQ2S youth. And then, of course, population-based programs, just ensuring that queer and trans youth have access to programs where they can be themselves, and where they can connect with others who identify in similar ways.